Based on what the province presented yesterday, we know that we are facing a significant challenge with the Omicron case counts rising exponentially and the number of new people testing positive that's expected in the days and weeks ahead. The government has projected that we need to do some work to be able to provide people with the hospital care that they will need throughout this month. So we expect this will have a large impact on the workforce across the healthcare sector, not only with the access to hospital beds and hospital-based services because of the large number, but because health workers themselves will be affected. So as Premier Ford and Dr. Moore said yesterday, almost everyone now will know someone who is or has been affected by COVID-19. We are bracing for the impact. We know that at this point, the transmission of the Omicron variant cannot be completely stopped. So I agree with the provincial decision to introduce additional public health measures in the community with the goal to slow the transmission of the Omicron variant and just lower that peak of the hospitalizations that may be needed all at once to make it manageable. The provincial decision to delay in-person learning in schools must have been very difficult to make. We know that schools should be the last places to close for the health and well-being of children and youth. Now that the decision's been made to move to virtual learning for the next couple of weeks, we will work with school boards to ensure that children who may need more support can connect with the resources they and their families may need in the weeks ahead. We know there will be harms from closing schools. For some children and youth, school is a place of respite where they can access support, food, and safety. Last year, the number of infants presenting with head injuries or multiple fractures more than doubled. And for families who face domestic violence, school is a protective factor. It's a place where they receive essential support. So we've seen from previous lockdowns that parents and caregivers report high levels of stress when schools are closed, when restrictions are in place and their ability to work is affected. Also, during previous periods when schools were closed for in-person learning, we saw more mental health challenges and increased hospitalizations with diagnoses such as depression and anxiety and eating disorders. So children and youth and their families are facing a tough time. It will be a difficult period to get through. It might be a few weeks or to a month. And so right now we need to do everything we can to take care of each other. It is more important than ever to reach out to friends and families and neighbors to offer support and give each other a break from what can be a challenging time. So I will continue to advocate for schools to reopen as soon as possible for the health of children and youth. And through this period, parents will need extra help with childcare and remote learning. And so we want to weigh the risks of mixing with other children from other households outside of school. We know what's most important to prevent further transmission is to screen for symptoms daily and stay home when you're sick. So don't gather indoors with people outside your household unless it's for that essential support. And as the mayor and the chair mentioned, there are supports in the community to help you or someone you know. So there is the mental health crisis line, la ligne de crise en santé mentale, 24 heures sur 7, one call, one click for people to access mental health and addictions care. The distress line, many of these things, they're all listed on the Ottawa Public Health website. So unlike a year ago, when we lived through similar public health restrictions, we do have the protection of vaccinations now. And we're continuing to work hard to help older adults get their booster doses. And we're working to prioritize teachers and education workers, childcare workers to get their booster doses too. We also want to give children and youth access to their first doses as soon as possible. And we're preparing for the second doses to start by the end of January. We're entering a new year, and I know we'll take care of each other as we face these challenging times. We are a strong community that supports one another.